Here's a bombshell that should make every parent sit up and take notice. America's top disease prevention expert was just shown the door after refusing to rubber stamp potentially dangerous changes to children's vaccine schedules. And this is where it gets controversial. She's now sounding the alarm that deadly childhood diseases we thought were history might be making a terrifying comeback. The public health establishment is in complete chaos right now, and what's happening behind closed doors at our nation's health agencies should concern every American family. Susan Monarez, who served as the Centers for Disease Control and Prevention's director for barely a month before being terminated, delivered shocking testimony to senators this Wednesday that paints a disturbing picture of political interference in life-or-death medical decisions. But here's where it gets really unsettling. Monarez isn't just another disgruntled former employee with an axe to grind. She's warning that diseases like polio and whooping cough, which we've successfully kept at bay for decades, are positioned to surge back across the United States under the current leadership structure. I have deep concerns that preventable illnesses will resurface, and I fear we'll witness children suffering from conditions that are entirely avoidable. Monarez testified before members of the Senate Health Committee, her voice carrying the weight of genuine alarm. The most explosive part of her testimony, Monarez revealed that Health Secretary Robert F. Kennedy Jr. demanded she approve revised vaccine guidelines without providing any scientific justification whatsoever. When she pressed for research data or clinical evidence to support these sweeping changes to childhood immunization protocols, Kennedy allegedly came up empty-handed. And this is the part most people miss. According to Monarez, Kennedy claimed he was in daily communication with the president specifically about overhauling the entire childhood vaccination framework. Think about that for a moment. Critical medical decisions that affect millions of children potentially being made through political conversations rather than scientific review. Former CDC Chief Medical Officer Deborah Howry corroborated Monarez's account, describing her own troubling encounters with Kennedy's political team. In an unprecedented move, these advisors inserted themselves directly into the preparation process for meetings of the CDC's Vaccine Advisory Panel, a group that traditionally operates based on medical expertise and scientific evidence. Here's a perfect example of how ideology might be trumping science. Howry offered to present data about hepatitis B vaccinations given to newborns, which help prevent the transmission of this potentially fatal disease from mother to child. A Kennedy advisor reportedly dismissed this information outright, labeling it as biased simply because it might support maintaining current vaccination recommendations. Republican Senator Bill Cassidy, who happens to be a practicing physician and chairs the influential health committee, seemed genuinely concerned as he listened to these testimonies. His questioning cut straight to the heart of the matter. To clarify, he indicated there was no scientific evidence or data available, yet he still expected you to modify the vaccination schedule. Cassidy walked a careful line, expressing support for President Trump's health initiatives while making his unease about Monarez's dismissal crystal clear. This balancing act reflects the broader tension many Republicans face when Trump administration policies conflict with established medical practices. The circumstances surrounding Monarez's rapid firing raise serious questions about the future of evidence-based public health policy. She was unanimously approved by Republican senators for her position, yet lasted less than 30 days before being forced out. Her crime? Refusing to sign off on vaccine changes without scientific backing, and declining to terminate experienced CDC career officials without legitimate cause. But here's where the controversy really heats up. Kennedy has pushed back against Monarez's version of events, denying that he demanded rubber-stamped recommendations, while simultaneously admitting he called for staff firings. He's even gone so far as to claim Monarez told him she was untrustworthy, an allegation she firmly disputes through her legal representation. The political divide on this issue is stark and telling. Democratic senators, who universally opposed Monarez's original nomination, now find themselves defending her integrity. Senator Bernie Sanders didn't mince words. Honestly, she took a stand to protect American citizens' health and safety, and that's precisely why she lost her job. Meanwhile, some Republican senators are taking vastly different approaches. Kansas Senator Roger Marshall, also a physician, aggressively challenged Monarez about her philosophy regarding vaccines, even as she explained her decisions were rooted in scientific methodology. Alabama Senator Tommy Tuberville suggested that Monarez's primary obligation should have been loyalty to Kennedy rather than adherence to medical evidence. America deserves much better than this situation, Tuberville declared, though his comment leaves room for interpretation about what exactly needs improvement. The timing of this Senate hearing couldn't be more critical. Just one day later, the Vaccine Advisory Panel began their two-day session in Atlanta to evaluate recommendations for COVID-19, hepatitis B, and chickenpox vaccinations. Panel members have already expressed skepticism about hepatitis B shots for newborns and suggested more restrictive COVID-19 guidelines. What makes this even more nerve-wracking is that these recommendations don't automatically become policy. The CDC director must officially endorse them first. Currently, that responsibility falls to Jim O'Neill, the Health and Human Services Deputy Secretary, who's serving as acting CDC director. I'm extremely anxious about what might happen, Monarez admitted when discussing the panel's upcoming decisions. This entire situation raises fundamental questions about how medical policy should be determined in America. Should political appointees have the authority to override scientific consensus without providing evidence? Are we witnessing the beginning of a dangerous erosion of evidence-based public health practices? Here's the uncomfortable truth that nobody wants to discuss. If preventable diseases do make a comeback, it won't be politicians' children who suffer first. It'll be kids from families who can't afford private health care, or who live in communities with limited medical resources. So here's my question for you. Do you believe political ideology should ever supersede scientific evidence when it comes to protecting children's health? Are we potentially sacrificing our kids' well-being on the altar of political loyalty? The comment section is open. I want to hear whether you think Monarez was a whistleblowing hero or an insubordinate employee who deserved to be fired. This debate affects every family in America, and your voice matters.